Everyone needs moments of solitude. Spending time alone can be calming and even help relieve stress. However, being alone takes on a very different meaning when it is not chosen, but imposed or gradually forced upon someone. In those situations, the consequences can become far more serious than expected. And although people react differently depending on who they are, the effects generally intensify and last longer the more isolation continues. When a person is confined against their will to a single place for an extended period, whether for days, weeks, months, or even years, without meaningful activity or interaction, their body and mind begin to undergo significant changes. So, what exactly happens, and why? At the beginning, levels of stress hormones tend to rise sharply. As time goes on, this stress doesn't fade, it becomes chronic. Human interaction and purposeful engagement play a crucial role in maintaining emotional balance. One reason for this is that they provide what researchers describe as social reality checking, a way to compare our thoughts with others and evaluate whether our perceptions make sense. When someone is deprived of this kind of communication and stimulation, their sense of identity and grasp on reality can begin to weaken. Their thoughts may start to spiral, and impulses can take control, leading to depression, obsessive thinking, suicidal thoughts, and in some cases, even delusions or hallucinations. Over time, this constant psychological strain affects the brain itself. The limbic system, which is responsible for processing fear and stress, can become overly sensitive and hyperactive. At the same time, the prefrontal cortex, the area responsible for reasoning, decision-making, and moral judgment, may begin to shrink, reducing concentration, memory, and cognitive abilities. As a result, the balance shifts away from logical thinking toward emotional responses. And the longer someone remains in this condition, the more deeply this imbalance becomes rooted, making them increasingly vulnerable to anxiety, anger, and irrational behavior. Isolation doesn't just affect the mind, it also impacts physical health. People may lose their sense of time and struggle with sleep disturbances. They are more likely to experience symptoms such as heart palpitations, headaches, dizziness, and heightened sensitivity to their surroundings. Weight loss can also occur, often due to stress-related digestive problems and a reduced appetite. Some individuals try to cope by creating structured routines, including exercise, reading, or writing. But under extreme and prolonged isolation, these strategies can only provide limited relief. Because of these severe effects, many experts, along with international organizations and human rights groups, consider prolonged forced isolation to be a form of torture. Despite this, it remains a reality for many incarcerated individuals around the world. Known as solitary confinement, or sometimes restrictive housing, this practice is especially common in certain countries. For example, in 2019, over 120,000 prisoners in the United States were held in solitary confinement, spending between 22 and 24 hours per day in small, often windowless cells measuring roughly 6 by 9 feet. This system was originally introduced in the late 18th century by Quaker reformers as an alternative to physical punishment. They believed that isolation would encourage reflection and repentance, which is how the term penitentiary came about. However, criticism emerged quickly, from public figures to legal authorities. The writer Charles Dickens famously described solitary confinement as being worse than physical torture. Although its use declined for a time, it resurged during the 1980s, alongside stricter criminal policies and rapidly increasing prison populations. As prisons became overcrowded, incidents of violence, protest, and unrest also increased, leading authorities to rely more heavily on isolation as a control measure. In many cases, individuals have been placed in solitary confinement for minor, non-violent offenses, such as arguing with prison staff. While isolation is harmful to anyone, it is particularly damaging for those who already suffer from mental health conditions, as it tends to worsen their symptoms. The effects of solitary confinement can also persist long after release. Former inmates often struggle to readjust to normal life. They are significantly more likely to develop symptoms of post-traumatic stress disorder, and frequently report personality changes, heightened anxiety and paranoia in everyday situations, as well as difficulties focusing and forming social connections. Some regions have introduced restrictions on the use of solitary confinement, especially for vulnerable groups such as individuals with severe mental illness, children, or pregnant women. In certain places, limits of 15 to 20 days have been established. However, these regulations are not always consistently enforced, and loopholes are sometimes used to bypass them. Ultimately, solitary confinement causes serious harm that undermines rehabilitation efforts and does little to reduce violence within prisons. In contrast, other countries have adopted more humane approaches. Norway, for instance, incarcerates fewer people per capita while investing significantly more in living conditions, education, and reintegration programs. As a result, far fewer individuals return to prison after release, giving the country one of the lowest recidivism rates in the world. This suggests a simple but powerful idea. Human beings tend to do better when they are connected to others.